Hello, everyone. My name is Callie Shu, and I'm the medical legal advocate here at First Shift Justice Project. This webinar will offer a brief overview of what types of workplace accommodations are available in Washington, D.C. for perinatal patients. I will also cover tips for writing accommodation notes to make them legally sufficient. Your notes as plan providers are essential to your patient's ability to request and access modifications to their workplace, which allow them to continue to work safely during pregnancy. So a medical note that meets legal requirements is less likely to be rejected by an employer. We want to reduce the need for notes to be rewritten, for the likelihood of that note being rejected, and overall lessen the burden for additional work for medical providers. So hopefully these tips will help with that. In Washington, D.C., workers have a right to reasonable on-the-job accommodations during pregnancy or for any pregnancy related health condition, and that includes lactation. Some examples of accommodations include more frequent bathroom breaks, carrying around a water bottle at work, permission to sit, and lifting restrictions. An accommodation can also be time off because of a perinatal health condition or for pregnancy-related care. Pregnancy accommodations are protected under both the D.C. Protecting Pregnant Workers Fairness Act and the newly passed Federal Pregnant Workers Fairness Act. And here are some general rules of thumb for writing accommodation notes. When you are writing a note to support your patient's request for work-related pregnancy accommodations, be sure to specifically identify pregnancy as the medical basis for the request because that will trigger the legal protections. If there are pregnancy complications, it is generally helpful to add additional diagnoses to further justify the need for those accommodations. Sometimes your patient might bring up the need for accommodations at an appointment because they're already experiencing discomfort or pain in performing their job duties. So, for example, say your patient comes to you, they mention to you that they lift 50-pound boxes at work. And they don't feel safe lifting those boxes, and lifting those boxes are actually really uncomfortable and sometimes painful. You, as their med provider, agree that it makes sense to recommend a restriction on lifting anything over 25 pounds. If the person has a high-risk pregnancy or has a complication that has an independent diagnosis in addition to pregnancy, it would be helpful to note that. The recommended accommodations should be tailored to your patient's specific needs and to their specific workplace. If your patient is only asking for a specific set of accommodations, that note should address only those accommodations. The client who needs a lifting restriction should receive a note that is narrowly tailored to that need. Generic medical notes, for example, the ones that include checkboxes for other types of accommodations, such as water breaks and rest breaks, bathroom breaks, those are not recommended. Sometimes these issues may not be applicable or a problem for that particular patient at work, and including a lengthy list of all of these accommodations that the patient might not even need may cause an employer or supervisor to regard their accommodations request as unreasonable. However, these issues of access to water, rest breaks, bathroom breaks, these are all good measures, and they are great to discuss with your patient before sending your patient back to the workplace with a no, because that discussion may surface actual needs that you were not aware of. It's best to avoid vague expressions like light duty or until further notice, which can render the request more likely to be denied by the employer as unreasonable. Including the beginning and end dates of the accommodations is important as well. If you expect the accommodations to be needed for the length of the pregnancy, use the pregnancy due date as the end date. If you are monitoring the patient's condition, then you can indicate the next appointment date as the end date of the accommodation. If the condition giving rise to the need for the accommodation persists, you can just renew the request by giving the patient a new no with a new end date. So when should you refer your patient to First Shift Justice? We do not expect you all to be lawyers, so please refer to us if your patient is having any issues accessing pregnancy accommodations at work or anything related at work. Here are some examples or some example reasons for why it could be helpful to refer your patient to us, but the general rule of thumb is that the earlier the better, and The bottom line is please refer your patient to us if you have any concerns. I also want to emphasize that we take cases regardless of immigration status or ability to pay. And if you have any questions or comments, please feel free to reach out to me. Contact information is on the screen. I know this was very brief and these topics are actually much more complex, so please do not hesitate to reach out. Thank you so much for watching.